Hello, everyone. Thank you for joining today at another Survive and Thrive Advocacy Center Third Friday event. My name is Lisa Coy, and I'm with the University of South Florida. I'm going to turn it over to Robin, and she'll tell us about the Survive and Thrive Advocacy Network.
Great, thank you. And Lisa, thank you, and Just in Time Training and USF once more for being our guide and our host. So, hello, everyone. My name is Robin Hassler Thompson, and I'm the Executive Director of the Survive and Thrive Advocacy Center. We're an anti-trafficking agency here in North Florida. We assist in the counties that are all surrounding Leon County and Tallahassee, our capital. And we also do these kinds of programs, which of course are here for everyone in our service area, but also beyond. And I see some beyond people here. We have someone all the way from Washington State, I think I saw, and tons of people from around Florida. So thank you. We do work to assist all trafficking survivors. So sex trafficking and labor trafficking, regardless of age, regardless of any other status. So we're not limited in terms of that. And we do that kind of care management. And I know that my colleague, Graciela Marquina, is here with us today. Graciela is the heart and soul of STAC's direct service delivery to survivors since our inception 10 years ago. We have assisted over 250 survivors of human trafficking, both sex and labor, and really minors as well as adults, etc. And Graciela works tirelessly in our community to do that work and also to do lots of community outreach. We do that outreach. We have many rural counties, and I looked at the chat and saw where you all joining us from. You're in rural counties too, and you know some of the mythology around, is trafficking happening in our rural areas, or is it only big city phenomenon? And of course, it happens everywhere. So we're always intentional about working on those issues. And actually, I think you addressed that in your report, didn't you all? So we'll talk more about that. We do lots of community education. I think we've probably trained over 22,000 people now since our inception, both in programs like this, as well as in-person events, as well as specialized training we've developed for banks or for other workplaces. We've certainly done lots of healthcare professional training. And we do that again intentionally to really support survivors, because so many people do not understand what human trafficking is still, and don't understand. If they think they know, they might have gotten that information from Hollywood or from TikTok, I don't know what, but there's too much mythology or too much misinformation about trafficking. And that's another reason why we do this. For those of you who are in agencies, and if we have survivors here, I just want you to know this is why we do it, so that when you go to reach out for services or connect with others, that you truly do understand what human trafficking is and what it is not. So the training is real important. Next slide, please. And what we do also in that outreach, you can have access to completely free of charge on our website. So I wrote toolkits galore. We have a youth and caregivers toolkit. We have information for agencies. They're interesting things. I think when we developed our agency toolkit, and we even had billboards at one point, but all of the outreach and really the headlines to all the outreach, we don't mention human trafficking quite deliberately because of all of like the not people who don't understand what it is, but rather we talk about how someone might be being impacted if they are trafficked. So check out our resources on our website. And also know that every month at this time, unless there's a holiday like in December or something else comes up, but we have these third Friday programs. And I'll just give you the teaser for next month. Brent Woody and Danielle Lennox are going to be presenting. Brent is the statewide and national expert on human trafficking expungement laws. And Danielle is a lawyer with the Broward U.S. State Attorney's Office. and they'll be talking about expungement, and it is one of the most powerful ways you can learn about survivor realities is to listen to these two individuals speak. So know that that's next month in August on the third Friday. I think it's the 15th. Our services are free of charge. Of course. Next slide, please. I don't know if any of you are podcast people, but if you are, please feel free to take your phones out and subscribe, as they say, subscribe, rate, and review, and listen to Imagine Freedom. Stack is, and we want, when we started this, we thought about how can we have survivors' voices be amplified in our world? How can we have what survivors want us to know be known? And so for that reason, I have the amazing good fortune to be able to sit down with survivors of sex and labor trafficking and talk to them about what they want us to know. And this is not the exploitative types of worst things that ever happened in anybody's life conversation. This is truly a way for us to learn and really develop depth in our work because we understand from experts about what's going on. So feel free to take advantage of our podcast. Next slide. And of course, I know all of you are probably feeling it too. We're in such uncertain times. We definitely want to keep these webinars free of charge. We want to keep our services going strong. And of course, the only way we do this is with help from you. So, and also, I don't know how many agencies, I hope more are getting to it, but every time a survivor does work with us, they are compensated fully for their work. And all of this is real important to us. So if you would like to contribute, we would be very grateful. So thank you. Okay, next slide. Okay, today, and the serendipity around this is fantastic. And I want to just tell you that we are so fortunate to have three people presenting today on the first time the state of Florida has had such a comprehensive report on the data on and the impact of human trafficking in our state. So what we've decided is I would let you know that Dr. Joan Reed is here, that Dr. Shelley Wagers is here, and that Kaylee Pate Carter is here. And all three of these professional criminal justice, social work experts, and your expertise spans many different disciplines, as it should, are here to talk about not just their work on this report, which is fantastic. If you haven't seen the report, know that it is in. It was up on our website and in the chat. We'll put it in the chat. But also know that they're going to talk about the Bright Project, and they'll tell you, and we're honored at STAC to be at the gold level, soon to be platinum, I hope, a participant in Bright. Again, these are groundbreaking professionals doing groundbreaking work here in the state of Florida. So we are more than honored that they're here. And also, just you might see Jamie Rosslin. Jamie is a consultant to STAC. She is going to help co-facilitate today, or moderate if needed. But Jamie, you're here as backup and support, and I thank you for joining us. Jamie has done amazing work with STAC in a lot of different ways, and you've seen her on these programs as well. So welcome, Jamie. And now we're going to switch to the PowerPoint of the hour. So Kaylee, I'm going to turn it over to you and Drs. Wagers and Reed.
So good afternoon, everyone, and thank you so much for joining us this afternoon. I feel like you're having a premiere event of the statewide report on human trafficking that we just completed less than a month ago, and so this is really our first time actually presenting on it. So thank you for being here, and we can't wait to share this with you and get your feedback. So I am Dr. Joan Reed. I'm a professor of criminology and the director of the Trafficking in Persons Research Lab and Data Repository. We call it TIP Lab for short because the title gets really long. And as Robin said, I'm co-presenting with my two amazing colleagues, Dr. Shelley Wagers and Kaylee Carter, who have been with the TIP Lab from its inception. So accurate and complete human trafficking data collection has been a long-term challenge for the state. And it's actually not just a problem in our state, but it's also a problem in the US and globally. And I've spent my research career anyway, the last 15 years, literally chasing human trafficking data. It has been probably the most difficult thing I've faced as a researcher. Because absent data, it can appear as if there's not a problem, there's no victims, and without data, there's no foundation for evidence-based practices and policies. And there's numerous obstacles that we kind of list here on the slide for gathering and analyzing human trafficking data. One, every agency collects data that best fits their needs and their objectives and goals. And so, for example, law enforcement collects a very different data points around human trafficking than service providers. And so when you try to begin to aggregate and analyze that data, it becomes difficult. Of course, it's understandable, but it does make it complicated. More importantly, the data is often kept within those agencies and siloed and not shared outside of those agencies. And as you know, as experts on human trafficking, what makes the situation even more difficult is that human trafficking is a hidden crime. Often people are just not visible to others. Traffickers work hard to prevent victims from reporting their victimization. Often victims don't even understand that they are being exploited, and to the extent that they are. And to those who are not trained or understand human trafficking, they can look to that outside observer as willing participants in the crime being committed against them. And so given all of these difficulties and circumstances, it's critical to purposely move forward in gathering data to try to make that hidden and invisible crime more visible to those who have the responsibility and ability to make action toward disrupting human trafficking in our communities and our state. So, as I mentioned, there's a myriad of reasons that access to human trafficking data is withheld from researchers and policymakers. As a researcher, and those who make policy, those are the very people that need that data in order to understand the complex societal problems such as human trafficking and develop solutions. But often, as I've said, I've chased data my whole career as a researcher. It has been very difficult to get people to share their data with me. But data is required for identifying those problems and to finding solutions, and then even evaluating those interventions that are completed. So in criminology, I think it may be unique to our profession. We pursue the knowledge and understanding of what we call the dark figure of crime, meaning we try to understand and estimate the hidden amount of crime that's never reported. And human trafficking is often not reported. And so that makes it mask that true number of survivors and victims and the true scope and size of the problem. And so it makes uncovering that dark figure of crime essential to human trafficking disruption. So when you face all these different difficulties, you began to look for a solution, right? How can we solve this data problem? And we, at the University of South Florida in the TIP Lab, we began to pursue a statewide repository for anonymous human trafficking data. And we believe we call that project TIPSTR. And we believe that it's uniquely designed to be able to handle the human trafficking data problem. And so by aggregating, collaborating and aggregating the previously collected and anonymous administrative data that's already being collected. We alleviate many of the concerns around protecting human trafficking victim data. So before I start reviewing the results from the first annual report, I want to back up and just give a really brief history of the TIP Lab and why we opened it. And so we never forget the month that it launched. It was March 2020. So many of you may be able to remember what was going on in March 2020. It was an interesting time to launch a new initiative. But we were able to overcome many of the difficulties of opening a research lab during a pandemic. And I think in some ways, which maybe Shelley can share with you, the pandemic helped us to do a much broader outreach toward the whole state because we were limited to using Teams. But the objectives of the TIP Lab when we began it, because if you don't know me and you don't know Dr. Wagers, we're practitioners first, and then we became researchers. So we had a very different goals for the lab, I think, than you may often see with research labs. But of course, we wanted to build knowledge. We wanted to conduct innovative and interdisciplinary research to fill in those knowledge gaps around human trafficking, to learn more about why it happens, how it happens, what are community risk factors, how can we answer some of those critical questions that are so far have not been answered around human trafficking. We also wanted to be able to provide critical resources to the Tampa Bay area where we're located, but also throughout the state of Florida through the establishment of a data repository. And then through that, with that data repository, we wanted to be able to share knowledge, share effective solutions to human trafficking, and address the complex violation of human rights and societal norms, taking an interdisciplinary approach. As Robin mentioned, we're very interdisciplinary in our approach to looking at human trafficking, and we merge criminological, victim-centered, trauma-informed, and public health perspectives. So given our desire when we launched the lab to be a resource, the first thing we did was to conduct a needs assessment and ask as many people as we could how we could serve the anti-human trafficking advocates and movement within Florida. And this project was led by Dr. Shelley Wagers. So I'll let her tell you a little bit more about the needs assessment and what we found and how it grounded our projects in the TIP Lab.
Thanks, Joan. So as Joan said, or Dr. Reed said, I conducted the initial needs assessment. And one of our goals here in this needs assessment was to identify what could be key projects that are really needed in the field. So to do that, we wanted to make sure we prioritize giving voice to every type of stakeholder that works in the anti-trafficking movement, especially giving voice to lived experience experts and survivors. So these were kind of our stakeholder buckets that we identified, at least initially out the gate, are playing some type of role in trying to address trafficking. Dr. Reed and myself both had come from the field before we were academics and really believed it's important that what research we do has real translatable impact in the community to be used. So we did initial 35 to 100, we call it the initial wave, and that's where we identified the key findings from that initial wave were that everybody said they wanted good and accurate data. And hence TIPSTR, which we're going to go into great detail today in just a minute, was born from this idea of good and accurate data. Data currently existed in the silos. And what happens when it's in the silos is each organization or one of those stakeholder buckets, they collect data that they need that really help the role that they play. So law enforcement has specific goals and plays a specific role, so they collect data to help inform that, as an example. Whereas the health department might collect very different data, they have a different focus. So when everybody's collecting that data, but it exists in a silo, we don't know if we're counting people twice, if we're missing people who we're missing, if some people are seeking certain types of services but not others. So the goal then became creating TIPSTR is to break down those silos to get to the baseline of what and how much trafficking is happening in Florida, where and when. But another key we heard that you're going to see play out as we do this presentation was this term zip code level data, meaning although we need to know the state picture and the larger picture, we fight it in our own backyard. And we need to know at the county level what resources we have, what risks we have, and what we're doing to combat it and how much trafficking we have. So you'll see a little later how we worked on that state picture as well as the county level. The next was access to services. The idea that it's really difficult to locate and find services for survivors of human trafficking and do it quickly. It took a lot of time, and to know that those are vetted and safe services. So those became the key projects we're going to talk about today, TIPSTR and Bright. Next slide, Kaylee. So what sets the lab apart? When I sit and try to think about in the past 5 years, after thousands of hours of talking to and working with people in the field and lived experience experts trying to build Bright and work on TIPSTR, a few things stand out to me that really truly make the lab apart different. The first is we really do in earnest talk to, as researchers, listen to and hear what the field and lived experience experts are telling us are needed, and seek to take that and put it into our work. The next was the passing of the state law. So this report we're going to do today for Florida is kind of the first of its kind, in the sense that no other state has as comprehensive of a law that mandates so many different service organizations at nonprofit level, government level, to put all their data in one place to give a true picture. So Florida is leading in this sense, and that's truly groundbreaking. The addition of the victim survey, Joan will talk more about that, but that gets at what we call the dark figure of crime and criminology, which is measuring how many individuals in the state of Florida are victims but aren't in any of that other data we're talking about. They haven't ever reported or come to the attention to be counted in another way. And then, of course, Bright, which we'll talk about later in more detail, sets the lab apart because it collects data in real time related to connecting victims to services, that data goes into TIPSTR as well to give us a true picture. Next slide, Kaylee. So when we think about this slide, this is just giving you a bit of a visual on how that all comes together. So what also sets this apart is that the data is being housed at an academic institution with social science researchers that have a vast knowledge and expertise, specifically in understanding human trafficking and access to academic literature, in combination or in collaboration and partnerships with ongoing active participatory stakeholder involvement and putting our heads together, and then in a cooperation with the state legislatures and governor who created a policy to create the catalyst to create this major data integration. So it is those connections and partnerships that make us unique and different, and having an academic institution being the house. Next slide. And now what I'm going to do is pass it over to Dr. Reed so she can explain more to you in depth about TIPSTR.
This was the blueprint that we developed really in 2020 for TIPSTR. And it's been interesting that we've stuck with this blueprint, and it's actually a working blueprint. TIPSTR is now operationalized and effective. And so as Shelley mentioned, it includes, if you look at the right kind of side of the slide, we have Florida crime and court data. We have state-funded agencies that are social service providers who are providing data for TIPSTR, as well as Florida government data. And all this data was previously collected. It's not a new effort for anyone. It was just siloed and not being shared. And so that was one of our promises in the state bill, was that we wouldn't create new work for people. We would try to do the lift ourselves at USF. And then on the left side, I hope I didn't get that mixed up there, but on the left side over here, thank you, Haley. We have the unique data that we're collecting. One is from the Bright project, which will give us you'll hear more about that, but it gives information on what services are being used, what services are needed, where are there gaps in services, and maybe redundancies even in services, so that we can be more effective in providing services throughout the state. And then with the state victim survey, which I'm going to talk about in just 1 minute, we did a representative statewide sample regarding victimization and human trafficking. I think it's the first one ever done in any state. I'll be sharing you some of the results for that, and that also gives us a better idea of how large the problem is and what's not being reported. So there's a question in the chat. Can I go ahead and go for it? Is there specific data for children in foster care who are, so we do, DCF was our data provision for that, and I'll be sharing what they provided for us. Your specific question about whether or not they're in foster care, that's a really good question. I don't think that they provided us with, like, I'll show you what they provided us. And also, please take a look at the state report. It's 143 pages. We have an hour, so there's no way that today we can share with you all of the great findings in there. So please, it's there for you to take a look. It's got a great table of contents. If you click on something you're interested in, it takes you right to that page. Kaylee was the organizer of all this report, and so please take advantage of that. I think it can answer some of your questions about what data we have and what data we don't have. As Shelley mentioned, Kaylee, go ahead with the next slide. As Shelley mentioned, a huge milestone for us was the passing of Senate Bill 7064, which was signed into law by Governor DeSantis in 2023. And it mandates that these departments and agencies share data with us, but it also mandates what we have to do. So it's not a free ride for us to get the data, but we have responsibilities to the state now. The primary one is to collect, aggregate, and analyze the anonymous human trafficking data that's collected by the various sections and agencies. And the human trafficking data that we receive, as we mentioned earlier, everyone kind of collects a different type of data. And so we have human trafficking screenings from DCF and DJJ, crime incident data, arrest and court data. We have some information on local demand indicators and service provider information. So I think you'll find it interesting. Hopefully all of you have can find something in the report that facilitates your work and is supportive of your work. And then we were also, based on those findings, we're tasked with informing anti-human trafficking stakeholders throughout the state of the regional risk and response and resiliency to human trafficking in their regions. I know when we did the first needs assessment, that was a huge ask of the people that we spoke with, that Shelley interviewed. Everyone wanted to know what's happening in my backyard, what is going on in my county. And so we tried really hard to get as much county information as we could and provide that to on the counties. And if we included in the report that counties, top 12 counties by population. So if you're in a county, a rural county that didn't get this information, we have an email address in the report, or you can email one of us and we will work on getting your information to you regarding your county. Go ahead, Kaylee. So this maybe this slide, this brief data snapshot got a lot of media attention, and it kind of is a snapshot of some of the data that we collected, and the different numbers that we have around for 2024. And we're going to continue today to kind of give you more details on each one of these numbers. Go ahead, Kaylee. So the first thing that we're going to talk about today is talk about Florida's risk. It shouldn't be shocking that we found high risk. And so we've known for years that Florida's at high risk for human trafficking. And so this is some of the risk data that we were able to gather and give you an idea of where the risk is and which counties are facing that. And I want to say that it's, although we have this data and it's super informative, it's not as comprehensive as I hope that we can be in the years to come. And so, but this does get some indication of where demand is happening. So one indicator of risk for particularly around sex trafficking is the demand for commercial sex. And so although commercial sex ads don't indicate, every ad isn't indicative of human trafficking, it does give us an idea of the demand in different communities. And so the Florida map that you're seeing on in this slide displays 340,000 ads that were extracted from online advertisement websites such as Call Escort, Mega Personal, Skip the Games, and others. And this is a 90-day snapshot of saw someone say something about Jacksonville. Yeah, it's shocking. I don't know what's going on there, but they have a lot of ads. So this is a 90-day snapshot. This is, from October to July 1 to October 2nd of 2024. So you can see that there's if you want to look at the cities, you see that Jacksonville, Orlando, and Tampa have those really high risk, high level of demand. Just on a side note, we are partnering with a group called Allies Against Slavery, and they have the data, the commercial sex ad data for Louisiana and Texas also. And when they put the Florida data in, they had to create a whole new legend because Florida's numbers were so much higher than Texas and Louisiana. It just all turned out to be white or black. So in order to get those shades of gray in there, they had to create a whole new legend. So Florida is at high risk for commercial sex ad. Yeah, I saw that. It was shocking to them and to us. Okay, Kaylee, move on. Another indicator of Florida's risk is businesses. So we the data that you're seeing right now is from illicit massage parlors, which are businesses, and the illicit massage business is one of the largest and most networked sex trafficking markets in the United States. There's a lot of research that's been done on this. And this data came from a group called The Network. It's an intelligence-driven counter human trafficking organization that collects and analyzes data. So basically, they review sex buyer reviews on massage parlors throughout the country. And we found, by reviewing the websites, they found 1,207 illicit massage industry locations in Florida that you can see there on the map. Again, we have Orlando, Miami, and Fort Lauderdale top the list as the highest numbers of hotspots for illicit massage businesses. Yeah, go ahead, Kaylee. Just a few more interesting things about the illicit massage businesses is that on the left, you can see when this business took place, and you can see most of it's in the afternoon, which is interesting. I think it's because Florida has a statute that these massage businesses cannot be open. Most of them cannot be open in the evening. So you can see the afternoon is the most common time for visits, and it also shows the pay, and the pay for services ranges from $50 to over $250. And then the map on the right is interesting. It shows growth between 2019 and 2024, and the growth in illicit massage businesses, as much as we're trying to counter it, was 47% in the state of Florida. Many counties had growth. The darker counties had the most growth. And then there's a few tiny little green counties, and those were the ones that actually reduced the number of illicit massage businesses. And that's Columbia, Bradford, and Manatee counties reduced the number of illicit massage businesses. All right, so next, let's talk about after we kind of got a glimpse at the risk, community risk, we want to talk about the statewide victimization survey. And I want to tell you a little bit about it and why it's so important. One is that it's representative of the population in Florida. And when we say it's representative, it means that we can extrapolate based on the findings across to the population of Florida. We paid a lot of money to get a representative sample from the only survey administrator that would do it. We asked we put out a bid for it, and only one company would do it. And so we're really excited that they were able to provide this representative sample for us for Florida. And so what that means is that, well, I'll just tell you a little more about what we found. So first, we estimated the number of human trafficking adult victims and survivors. So we only surveyed adults, and we used the most researched and validated HT screener in order to estimate the number of human trafficking victims and survivors across the state. We used the Quick Youth Indicators for Trafficking screener, which we can, it's been validated among youth, both homeless youth and in ER settings. And so it's the most solid screener we could use. And the estimate was that 9.4% of respondents were likely to be a human trafficking victim or survivor in Florida based on the responses to the screener. We have more information about this in the state report. I don't know how many of you are researchers, but basically the screener had a 1% margin of error with a 95% confidence rate. So basically we can say with 95% confidence that 9.4% ranges between 8.4 to 10.4% because of the size of the survey. So then we took the number of Florida adults, around 18 million, and we came up with an estimate of 1.7 million adult human trafficking survivors who could be in need of services in the state of Florida. So after getting the overall rate estimate, the survey asked specifically about sex trafficking and labor trafficking. You can go back, Kaylee, I'm not quite there yet, sorry. So for sex trafficking, we asked the respondent really specific questions about had they engaged in a sex act in exchange for anything of value. And we were able to clarify in several different ways if that was accurate. And we asked if this occurred when they were under the age of 18 or because they were coerced, forced, or tricked. In different ways, we asked them that when they were over the age of 18 or older. So you can see the percentage of respondents that purported experience sex trafficking as a minor and sex trafficking as an adult. For labor and for labor exploitation, it's much more difficult to ask these questions, and labor trafficking is just much more difficult to prove. That's why there's so few cases in court and those kind of things. But we did use the best items that we could find that have been used by prior research by experts on labor trafficking. We asked respondents if they'd experienced various forms of exploitation at work. That's why I have labor exploitation and our labor trafficking down there, because we really are able to kind of narrow in on exploitation. So we asked them whether they had been sexually or physically assaulted at work. We asked if they'd received threats to them or their family in order to, exploit them and to coerce them into working. We asked them about whether they had restricted access to food, to sleep, to legal documents, and to outside communication. So we used the best measures we could. And so not all of these respondents could be experiencing labor trafficking, but they definitely were experiencing some form of labor exploitation. Okay, Kaylee, go ahead. And so then we ask, of those, where did you experience it? 63% experienced this in Florida. 65% told someone about it. 28% indicated that it occurred when they were a minor of the labor exploitation. 9% reported it to law enforcement, and 21% attempted to seek services or help. When we look at the sex trafficking of minors, we can see that 58% reported that this occurred to them, it occurred in Florida. 66% told someone about it. 12% reported to law enforcement, and 33% attempted to get some services. When we talk about adults who reported sex trafficking, 68% experienced this in Florida. 54% told someone about it. 42% attempted to get social services or some kind of service, and 10% reported it to law enforcement. So you can see that much of human trafficking goes unreported. And it's kind of heartbreaking for me to understand how many people had never really told anyone about this experience. So maybe this would be a good time to take a few questions.
Joan,
yeah,
there's a question in the chat. One, I want to address multiple questions about where are these charts? Can we get them? Can we get copies? So I just want to reiterate to the whole group. All of this is in the state report. We've put the link to the state report in the chat. I believe, Robin, you also have it on the page next to the webinar. So we're just pulling out a few of them to highlight here. And so please download the state report and look at them in detail. And then the other question, Joan, someone was asking about why labor trafficking is harder to prosecute in court. So I didn't know if you wanted to address that question. Yeah.
It looks like Robin hit it already. So she
Okay.
would be able to answer it better than me. It's just, I know that it is. If you go look and see the court cases across the country, they're mostly focused on sex trafficking of minors because it's that forced fraud and coercion piece. And you have to prove it for both sex trafficking of adults and all labor trafficking, even children. Like there's not an exception in the labor trafficking law for children. They have to show that they were forced or somehow tricked or coerced into labor trafficking. And it's just, I could talk about a few recent court cases and why the jury made the decisions they did. And I think a lot of it is around that forced fraud or coercion. People don't understand it. You know, they think, well, I could go on, but that's not the purpose of this.
Well, and let me just jump in by saying, I think I want to answer this question in a whole new webinar that we can have and talk about that because it is very rich. And I think that what we see on and on, I sat next to somebody at a community meeting recently and she looked at me and she said, "What is labor trafficking?" And we have that here in Tallahassee. So people do not understand what labor trafficking is. They also don't see when somebody might present as a survivor of sex trafficking that they have also been labor trafficked. So there could be a whole host of other charges that could be brought. There is a set of remedies that would be available to the survivor. That's part of their healing, is to recognize that they have been both labor trafficked and sex trafficked. And it's just a different world. So I think there has to be so much more work done in highlighting that, and also in just staying on top of it. Everybody, it can be a longer thing. You can walk into a restaurant and see people working and not know that they're being labor trafficked, and that is not the case with prostitution. Often, right? It is a crime already. It's not a crime to work. So we could talk about it a lot. Great question. And I can't wait to hear it. More people put in the chat.
Yeah, if you look at those numbers, you can see the labor exploitation number was much higher than the sex trafficking number. And, if that's true globally, if you compare globally the incidence of sex trafficking compared to labor trafficking is also often reported as 3 to 4 times higher in terms of prevalence. So I don't think it should be very surprising to us that we got that high number, given a lot of the industries that we have in Florida that often have labor trafficking involved. So
also, I'm going to touch on one I've been doing in the Q&A really quick, which is what was most challenging for us. And I said the most challenging thing was to actually get the agencies to give us the data. That they all said they would give us data, but then they wouldn't. And then even after the law was passed, some were much better than others. And I'm not going to say which is which, but Without the law, they wouldn't have given the data, and the law allowed them to dump the data to us in whatever form they had, and then we had to deal with cleaning it and fixing it and merging it. I say we, Joan and her team, because there's just something, people are scared to give their data. And someone else asked if these were aggregates. These are all aggregate data that we're using. So our goal wasn't to call any particular group out in any way, but just to show the data as it was. So Florida has a good blueprint. So coming up soon, the law, Joan didn't talk about it, has a sunset clause, and that is coming up. And so we have one more year under the original law. And so I believe USF is working on trying to talk to the state legislatures to continue the law so we can provide the longitudinal data over time. And I think everybody's questions are great. Appreciate all the interaction. I'm just going to remind everybody in a time check that we got 5 Ps we're about to go through. So if it seems like we go through all these slides very quickly, it's because all of these are in the state report, and we just want to try to highlight to you all some of the content so you know what sections to go to for deeper dives.
Okay, Kaylee, let's move forward into prevention. Well, I'll start. We have 5 Ps. You guys will get it. It's the 5 Ps of human trafficking response: prevention, prosecution, protection, policy, and partnership. We divided all the information and data that we collected into those 5 Ps. I also go ahead, Kaylee. One more slide. I also want to give it was anonymous. We collected anonymous human trafficking data from over 30 state agencies and service providers. So this was all anonymized. There's just, if you look at the state report, there's just no way that anyone could ever be identified from anything that we shared. And I also want to say that this was in response to the Senate bill that was passed, and also the UN, if anyone's interested, wrote a 100-page paper on using administrative data to address human trafficking, which is really, it came out after we kind of had this plan, but it was very cool to see that they had some guidance on how to do this. And there's also some caveats, I guess I would say, in interpreting it. It's important to note that if you have a high number of human trafficking incidents or screenings, which you'll see in a region, it's not 100% indicative that region has a higher risk for human trafficking. It could also equally be indicative that they have a very effective counter trafficking response. And so I know this happened when I first started researching domestic minor sex trafficking in 2007 or 2008. I worked primarily around the area of Clearwater, and they had that human trafficking task force, that the first one I think that was ever funded by DOJ. And so I was able to get a lot of information out of the Clearwater area, and all of a sudden it made national news, like Clearwater has the worst problem of human trafficking in the whole country. And it wasn't that they had the worst problem, it was because they were trained, they were looking for it, they were finding it. And so sometimes if you see that a county has a lot of, let's say, screenings, that doesn't necessarily mean that they have a higher issue or a higher risk. It's indicative that people are working really hard there. And so that's just a caveat that I want to, be sure and explain. So when we look at prevention, DCF did share quite a bit of data with us. They shared their screening data with us. They shared their missing children data with us, which is all in the report. They shared also the child protective investigations, the results of those. And so I'll just kind of give you a brief overview. So they had over 600 screenings that they did, 669. And of those, at the end of the screening, the screener kind of indicates that this is definitely or likely a victim of human trafficking. So that's what you're seeing right here, where those youth were screened. And again, I have to say that the counties that did the most screenings also had the most, we found the most child victims because they're doing the screening. So can't say for sure the risk is higher in those. It could be, but it also could be that the other counties aren't doing as much work. And so that's why some of those darker counties, have higher risk. So you can see Polk, Orange, Brevard had the higher number of youth that were likely or definitely victim of trafficking. And so, and please look at the report if you want some more information. I will say that we found that the screener was the findings in the screener were highly associated to the child protective investigation results. So the screener was doing a good job in terms of identifying youth. So please use it and please screen. So this is kind of a little bit about, it was a higher number of females than males that were identified as trafficking victims. There's the ages of them. And then also these are the indicators from the screener, and that potential trafficking one, it's very kind of a confusing name. It basically, it means that it's kind of a summation of the items, including parent and guardian observations about concerning behavior. And so such as unexplained phones, monies, gifts, and verification of tattoos. And so that potential trafficking indicator is kind of means that their parent or guardian was finding things about the youth that was concerning. It could also, if they were in foster care, been a foster parent. So also the Department of Juvenile Justice did a astounding number of screenings, 8,527 in 2024. They use the screener a bit differently in terms of they use it more as a universal screener for youth coming into the juvenile justice system. And so you have a lot more screenings that are not finding trafficking. And so you can see that a really small number of youth that were classified. Flip the next screen. Next slide, Kaylee. They have a smaller number that were definitely is or likely is trafficking victim, and these are the indicators that were most prevalent among those. So excessive running away, that potential trafficking indicator where the youth or guardian was reporting. So it's interesting that this was a little bit different than the DCF findings. Kaylee, keep moving forward. We have Department of Education. So in 2019, there were some statutes passed about delivery of child trafficking prevention education, and you can see that there is education going on in the schools, but there's three different types. One is we called basic, which means that it was mentioned in some course that maybe had something to do with human trafficking. Or related. There's related, and then there was related courses, which meant maybe they were covering health or safety or good relationships or something that actually may be related to human trafficking, and they covered it in that course. And then there were designated, dedicated human trafficking courses, and you can see there's much fewer of those. So one of our recommendation is, to have that designated courses in all jurisdictions in Florida. So also, this is the information on task forces. I guess that was, I don't know if this is an interesting finding for you or not, but there are task forces throughout the state. And you can see January 2024, January is the month for events. And so Kaylee's going to talk a bit more about task forces and coalitions in Florida in a minute. Go ahead, Kaylee. All right, so our key takeaways, I guess I have to say, these are the key takeaways we put in the report. Better education and evaluation of education and training courses. Please expand and improve the use of HT screening tools. They do work. And address those community risk factors that I discussed earlier. I would like to say that a lot of the prevention we do in the state of Florida is on reducing the risk of HT or human trafficking after it's already occurred. And so primary prevention is needed, and that would be, those education and training programs for kind of universal prevention, not after human trafficking has occurred. I think I'm turning it over now to Kaylee.
Yes, thank you, Joan. So the protection section of the report focuses on protecting victims of trafficking from further exploitation. And some of those protections that we look at include identifying victims of trafficking, providing referrals, providing services or supportive services, and overall just prioritizing the victim's rights and needs. So there are a range of services that a survivor can need once they have successfully exited. And while we have identified over 600 providers for services across the state of Florida for individuals that have experienced trafficking, there are still a lot of gaps in those services. So as you guys can see from this map here of the identified providers, we do have a lot of clusters around those major metropolitan areas, but when you're looking towards like those more rural areas of the state, there aren't any providers identified in those areas, so that shows a clear gap. So as you guys can see on the graphic on the top of the slide, the least prevalent services across the state are translation services, demand reduction, prevention, transportation, and financial services. So although we do have a lot of those services available statewide, having that lack of transportation to get to those services can be a potential barrier. Additionally, despite that it is a need that's often cited by survivors, there were only 2% of the identified organizations across the state that were able to provide financial services. So things like financial literacy, safe banking, or loans for utilities for survivors across the state of Florida. Comparatively, the graphic on the bottom shows the most prevalent services. So although here housing appears to be very prevalent throughout the state, it can be a little bit misleading because this does also include homeless shelters, domestic violence shelters, and non-trafficking specific residential programs. So that's kind of all encompassing of where a survivor may be able to receive those residential services. However, when we look at it in a more granular level, so these are the top 5 services that are most commonly needed by trafficking survivors as they are working towards a successful exit. So that would be those residential and housing services, crisis and recovery, case management, mental health, and peer-led support. So best practices indicate that these specific types of services should be human trafficking specific when working with this particular population versus having that other classification for another victimization like domestic or sexual violence. So when we're taking that closer look at it and we're comparing the data from these 5 categories of HT specific versus non-HT specific, you can see that the ones that are non-HT specific but are still able to serve HT are far outweighing the number of programs that are designated specifically for survivors of trafficking. So although we do have a lot of services identified and available throughout the state, there's only a few programs that are truly meeting those best practices that are required to properly meet the needs of trafficking survivors. So one thing I do want to point out here is that concept of peer-led support as an example. So rather than it being a lived experience expert, this could be someone who has expertise in child abuse or substance abuse, those types of things that are also serving as an advocate to survivors, but not necessarily have had a trafficking experience. So some key takeaways for protection. First, there is a need to expand services to the areas of the state that have none, but we also have a great need for those 5 most critical services for HT survivors. So housing, mental health, substance abuse services, case management, crisis response, all throughout the state. As we're working to enhance the programs, we are also recommending that groups should consult with lived experience experts to assist in maintaining those best practices as we're implementing new and continuing programs. And with that, I'm going to go ahead and pass it over to Shelley to talk about prosecution.
Right. Thanks, Kaylee. So when we think about prosecution, what we're really looking at is the criminal justice response. This also includes law enforcement investigation through the case processing. Something important to think about here, and Kaylee can go to the next slide, the federal, is we have to look at federal laws, as many of you know, are separate from state laws. Those are jurisdictionally different. So every state, and Florida has a specific statute for human trafficking, and so do the federal cases. So oftentimes there could be a case that violates both of those, but they're only going to proceed through one or the other, the federal or through the state. So this data for the federal prosecutions is secondary data that came from the Department of Justice, basically. So it is readily available data. And the heat map basically shows you can see that for Florida, and Florida in general has a high rate of prosecutions compared to other states. That's why it's darker in color. And within Florida, you can see about 5 counties that are doing the most prosecutions, which would be Duval County, Miami-Dade, Broward, Hillsborough, and Orange County. Next slide, Kaylee. So the next set of data we had related to prosecutions was to look at what we from FDLE. So this would be the Florida state data. And we're going to look at what is arrest data as well as court data. So if you're not familiar with these acronyms, SRS and FIBERS, we're very familiar with them as criminologists. So I'm sure many of you have seen what we call the crime clock before off of data that talks about every so many minutes a certain type of crime happens. That data comes from the Uniform Crime Report. And the way that data happens to the federal government to create that is it comes from reporting from the states. So the states kind of report on crime in different ways, and that goes up. And that's kind of broad data. That's the best way for me to give you an example of what the SRS data is. So that data doesn't contain what we call key variables that might tell us victim-offender relationship or more demographics on the victims and the offenders. So at the federal level, years ago, they created something called NIBRS, the Incident-Based Reporting System, the National Incident-Based Reporting System. Several years ago, Florida passed a law to mimic that in Florida, and they call it FIBERS. So that's a long way to say that's what kind of this data is here. So all of the local law enforcement agencies report to FDLE, both their SRS data and their FIBERS data. And this data can tell us some different things. So on this chart here, what you see is the total number of human trafficking arrests. This is over time. So the key thing there is to see that those arrests are declining for some reason over time. And these are very specific to human trafficking arrests. And then what you can see is for 2021 to 2024, between the FIBERS and SRS data, the leading counties of the number of human trafficking arrests. So let's get that right. Specifically under the state statute, you had Hillsborough County led with 81. So if we go to the next slide, what we can start to see is a breakdown of that FIBERS data to get a little bit better idea of what types of arrests are happening and what this might mean. And something many individuals in the field and researchers agree on is due to some of the myths and the convergence of certain types of crime, especially around sex trafficking, like prostitution, and promoting prostitution, we often see victims being arrested under those statutes when they're actually victims of human trafficking. So in essence, this data, that's in sense what it's kind of showing us. If you look at the total number of like commercial sex acts, involuntary servitude, that N are the arrests. And then when you look at the N on prostitution and assisting, promoting prostitution, those arrests are much greater than what we saw for arrests on human trafficking. The line chart and pie charts are basically then showing you from 2021 to 2024, the ones with the triangle on the bottom are actually the human trafficking. The other two are prostitution and facilitating. So you can see we're misarresting. So oftentimes we could be misarresting individuals under those allied crimes versus the actual human trafficking crime. The next slide. This is what FIBERS can do for us is it starts to break down these characteristics of victim demographics and the offender-victim relationship. So the pie chart kind of shows you those victim-offender relationships. So what percentages were acquaintances versus they didn't know them, a stranger, a family member, or an intimate partner. So something important to keep in mind with the criminal justice data and the FDLE data that we have here is you notice under race characteristics, we see a high rate of victim demographics being white versus Black. Don't interpret that. This is why Joan did the victim survey, because this can have some inherent biases in there related to who actually reports to law enforcement, who comes forward to law enforcement. So this doesn't necessarily mean it's reflective of the percentage of who's actually being trafficked. It's just who's coming to the attention and being reported to law enforcement under the victim demographics and those offender demographics. Next slide, Kaylee. So the next slide then shows us the prosecution data, which is coming from the clerk of courts. And what you can see in the map is the heat map shows you the human trafficking related charges per 100,000 in Florida, the distribution of the defendant's sex. And so again, I think what we're really seeing in some of the criminal justice data and court data is some of those biases that exist in who we're seeing as victims and who we see as traditional offenders. And we see some of that here by the fact that most of the defendants were male, but many of us working in the field, we know that there's also females who may be defendants as well. And then the line chart, the total number of charges for human trafficking and the top 15 counties is just basically showing, you see Miami-Dade has the greatest number of charges, but you can also see those charges are quite a bit different and lower from what the actual arrest rates were, which are also low because that was just for human trafficking charges specifically. Kaylee, next slide. So overall, our key takeaways when we look at the criminal justice response and prosecution is we really need to standardize and improve our data collection across the board. In other words, it's key for law enforcement to make the correct arrest based on what's actually happening in the case, because that impacts the data that's sent to us and the data collected. And so it's key we really get standardized definitions, clear understandings of what victimization looks like, perpetration, and we act accordingly so that we get more accurate data. We also really need deconfliction efforts. Deconfliction is a law enforcement term, but what that really means is every police agency has its own computer, its own system. They don't necessarily talk to each other. So you're going to see here in a minute on partnerships, we've created partnerships and task forces and regions, and on those task forces, they may share information. But if you're not part of one of those task forces, you're not necessarily getting that information. And a task force, for example, that's in North Florida isn't necessarily sharing their information with a task force down in Southern Florida. So what happens is they end up working the same cases. They're tracking cases differently. So there could be overlap and biases in the data. So deconfliction becomes a problem for us to get good and accurate data. We need a way to unsilo those systems for law enforcement to communicate and talk more effectively with each other on these cases. And then we need to improve the link between the sources of human trafficking law enforcement data. So expanding the link of data related to the trafficking incident, meaning arrest and follow it all the way through the courts to see actually what happens in which cases. On that note, I'm going to turn it over to Kaylee. But Kaylee, I want to highlight a question somebody asked that also kind of goes into policy, but it went back to when Joan was talking about Department of Education and trainings, which is we mentioned about how some counties aren't doing the HT specific, but they're doing an allied specific training. And what they were asking is, if that's the case, wouldn't those be out of compliance with the 2019 law? Since you're doing policy, I thought it'd be a good one for you, but correct me if I'm wrong. There's specific trainings that have been identified as meeting the law. Some are specific on HT, some are allied enough they fit the law, and then some aren't fitting the law. Isn't that correct?
Yes. Awesome. So thanks for answering that, Shelley. I'll go ahead and move on into policy. So as we're looking at policy, we're looking at both the state and national level. So the data shown on this slide is publicly accessible, and it is demonstrating the number of anti-trafficking policies passed per state. So the darker the color, the more policies that have been passed. So as you guys can see, Florida is one of those darker states. So Florida has been a leader in human trafficking response for over 20 years in developing comprehensive legislation and working towards that coordinated response within policy. So in comparison to other states, looking at this top graphic right here, we can see that Florida actually has higher sentencing sentencing requirements than all of the other states combined when it comes to minor and adult sex trafficking maximum penalties, as well as with minor and adult labor trafficking maximum penalties. And then if we're looking here at the graphic on the bottom, we can see that we're actually making a positive trend in the policies related to prevention, prosecution, and protection over the last 20 years. And we've really been aiming to develop legislation that encompasses all three of those factors, particularly here in the last 5 years as well. So we are making some positive trends as far as the policy that we are working to put in place. So one aspect that we did notice during the collection of data for the annual report was how difficult it was to get data on labor trafficking, which I know we have mentioned a little bit already today. But for exploitation and trafficking response, preventing and responding to wage theft actually may give workers remedies before they fall victim to more severe control mechanisms like debt bondage or other work-related vulnerabilities that can keep workers connected to illicit employment. So in Florida, we actually only have 6 counties that have wage theft ordinances. So that's Alachua, Broward, Hillsborough, Miami-Dade, Osceola, and Pinellas. And so those counties that have been implementing those policies can inherently impact the amount of labor trafficking that may be occurring almost as a prevention mechanism. So this was just an interesting piece of data that we really wanted to highlight, particularly because there is often a lack of information on labor trafficking. But key takeaways for policy, it's important that we as a state are continuing to craft and enact survivor-informed legislation to make sure that Florida is a zero-tolerance state. We are also recommending to create a specific infrastructure that can prioritize input from lived experience experts, so that way as policies are being developed, it's not going to cause unintended harm by thinking that it's going to be a good thing, but then it can unintendedly impede progress, right, as survivors are trying to exit and go through that healing journey. So as I move into partnership, I'm going to let Shelly lead that, and then I will pick up just a little bit. So Shelly, you want to start there on partnership?
Sure. So the first thing is trying to, I see in the chat people like, we need to stop working in silos. And well, we agree with you. So that is one of the goals we're trying to do. And that's what we're going to talk about here under partnership is ways in the lab we're trying to help facilitate breaking some of those silos down, because we know frontliners in the field, everybody is so busy all the time. It's hard for them to move out of their local community and task forces and work with each other. So this first slide, what it's showing you are the partnerships we've been able to identify in the state. So partnership, there could be a task force, a coalition, or a commission. As an example, a task force, coalition, commission, all of them have kind of different goals. They might have different durations based on which type you're looking at, and focuses. A key way to distinguish a task force is they typically have law enforcement involvement. Commissions are typically set up by the county or part of county government, or a way that they're trying to drive dollars or be strategic in how they're addressing trafficking in their county. There's a couple different counties that have these. One is Bay County, another is Hillsborough County. And then coalitions can be nonprofits and others that are coming together trying to work together. So in this map, the darker color means they have at least 3 groups. It may not mean per se that they have one of each type, just there's a coalition or task force or 3 together overlapping in some way in a given region. So that's great because they're building partnerships with each other in those regions, but oftentimes they're not connecting with each other across the state. And we all know trafficking or traffickers don't stick in one jurisdiction, they move all across the state. So what we're trying to do on that side with task forces and coalitions and all of those anti-stakeholder bucket groups we talked about at the beginning is build a bridge and help find a way to address different issues. So these task forces, coalitions, they can find and talk to each other from the local area across the state to each other, and how to break down those silos and build more connection and cohesion in a way that everybody can see that data. And we're trying to see how we can take the technology that we already built in Bright that's been out there for a couple of years now and do new adaptations to it to help break down those communication barriers across the locations and people find and reach each other. So what Bright is a vetted online secure resource referral network for those who are providing care, but people often forget what the full acronym really means. The full acronym means Bridging Resources and Information Gaps in Human Trafficking. So although we focused first on a main focus is the victim services and developing program models, it also creates a database and data intelligence from it, but we're also looking at how we expand our technology in a way for deconfliction, as an example, for law enforcement to use, a way for task forces to locate and find each other, or who's a member of them, so certain groups aren't pulled in so many directions, participating on 3, 4. We have some we see participating on 5 different task forces or coalitions. So it's hard to, when you're in all those meetings, actually get the work done. So these are different ways we're trying to leverage Bright, but we want to just highlight last year we did a deep dive on Bright. So we're just kind of skimming through Bright this year to remind everybody. And I'm going to turn it over to Kaylee because a key thing in the victim services is people wanted a vetted network of care and raise standards of care. So she's going to touch on that and what we've been able to build out this year and what's to come.
Thank you so much. So yes, as Dr. Wagers mentioned, one of the key aspects was the vetting. So within Bright, we do have 5 different tiers of vetting for organizations. This can be determined by 2 main factors. So first, it's the type of services that they're offering, and then 2, how well they're meeting or exceeding standards as far as trauma-informed and survivor-centered care. So specifically for organizations that have reached that platinum level, they need to be exceeding our minimum threshold of vetting for 80% of the time as we're going through the over 100 components that are included in the vetting process. So I do also want to mention that most of this process goes onto the Bright team and not to the organizations, as we really want to make this as easy and as streamlined as possible to empower and raise up organizations and really enhance that standard of care all throughout the state. So to show y'all a little bit of data from the vetted networks in Bright, so what you'll see in the map on the left here is the mapping of all of our vetted providers across the state. So I am really proud to say that we do have providers all the way up in the Panhandle to all the way down in Miami and everywhere in between. But just like in that comprehensive care section, we are still missing services in those more rural areas, and all of the services do tend to kind of cluster around the metropolitan city areas. Also within Bright, we do have providers that are offering 1 or more services within all of those various service categories. So you are able to find any services that a client might need as you guys are working with them. So I was going to show you all our updates to the system, but really quickly, I'll just go over the main one in the interest of time. We are starting to bring on minor serving organizations now. So there is a new feature in the system where you can select if the individual is over or under 18, and that will filter out those specific organizations as you're looking for those services. An additional feature that I want to highlight, since last year, Bright is now mobile optimized, so you do not have to be working on a desktop to be able to utilize the system. You can have it on your phone and take it with you on the go. So if you're out in the field, you have access to all of those services as well. One additional feature that I do want to highlight that seems to be underutilized is the data entry portal. So as users make referrals in Bright, it automatically tracks and creates graphics for each individual organization to use for funding reports or however they see fit of how many referrals that they have sent, received, and for what types of individuals. However, we recognize that we don't have everybody in the state in Bright yet. So with the data entry portal, providers can enter that same information that they would likely be tracking on case notes, and it will add to that data dashboard that they have. So you can start to see all of your data all in one place. And then it also helps us know who you all are referring to, so we can make sure to add them into the system. So we're hopeful that in the next annual report, we'll be able to shed a little bit more light on demographics for individuals served and what services are most needed. So we definitely need your help with this. Again, just want to remind everyone, Bright is free as well, so please be sure to utilize this resource. A couple of quick statistics. So it takes less than 5 minutes to find services in the system. We currently have 103 vetted organizations in Bright across the state in all 12 of those service categories, and we have successfully connected 35 plus survivors to services. So when we're looking at the key takeaways for partnership, given the estimated number of survivors in Florida, a more efficient connection to and use of services is absolutely critical. So as Dr. Wagers mentioned, while there are a lot of task forces, coalitions, and commissions that are doing great work locally, we really want to amplify that work and make sure those partnerships can go across the entire state with Bright. And with that, I am going to pass it back over to Dr. Wagers to tell us about our coordinated response.
Thank you, Kaylee. I'm going to go through this pretty fast because about out of time. So the end of the report, we have a risk to resiliency score by county. So as we mentioned at the beginning, in the needs assessment, we heard really well, we need to know what's happening in our county. And Dr. Reed touched on already the idea that there's certain inherent risks, and some counties might have more of those. For example, a high rate of illicit massage parlor businesses, you're going to have a higher rate of trafficking. There are certain risks that come with labor trafficking, like a lot of hospitality and tourism, lots of construction. So also transportation related risks when there's ports and airports, the freeways and accesses. So certain counties carry more risk for different reasons. So what Dr. Reed set out to do with this and the team in the lab was to identify, based on risks, by county, a score. So we talk about, do you have these risks? Which of those risks do you have? And that's what we see in this first map. Then the next side goes, but what is your response? So we just went through the 5 Ps where you can see different responses and prevention efforts that might be in effect to go, how well is my law enforcement responding? How many victims service provisions do I have? Other things that help us go, how well am I combating the risk in my county? And then a third element came in, which was the resiliency score. So in these heat maps, always the darker color shows you have greater of that. So you can see here, certain counties have a higher resiliency score because they've got into place better prevention infrastructure and measures to proactively combat trafficking. So Kaylee's moving you along. I went so fast, she's not keeping up. So here's your response score. The purple shows the counties and the resilience. And then finally, what we looked at was creating a county by county typology. And so what we're looking at is some counties are performing better in the sense that even if they have a high risk, they have a really strong resiliency score and response score combating that risk. But then we have some other counties, as you guys saw in some of the data as we went, they might have a lot of trafficking and a high risk, and they're not having much of a response or resiliency. And the goal in this was, in the report itself, we highlighted about 12 of the most urban counties as an example. But what's important for everybody listening throughout the state to know is we can do your county. Joe mentioned it earlier. We have this for every county. We just was a lot to put in the report. And the goal here is so every county can look at and have data-driven decisions from year to year on, okay, well, I have these risks, but I have these things in place that can help create resiliency, or I can pass laws for better policy, for better response to help combat the risk. And then every year as we produce the report, you'll be able to see how you're doing each year, fighting it in that local center, as well as what the state can see as the larger picture. So we just wanted to highlight that that's in there. And even if you don't see your county in the state report, just reach out to us in the lab. We're happy to give you your own personalized county report to use. And with that, because we're about out of time, I'm going to turn it over to Joan because she's going to give you the future directions. And there is one question I said I'd answer live that is in there. I want to make sure we get to before we totally wrap up.
Go ahead, Shelley. Go ahead and answer.
Okay.
It
has to do with partnerships related to anti-labor trafficking work. How involved has the State Department of Labor been, and what about labor advocacy? And all I can say is I don't think the State Department of Labor has been very involved, Joan, but I know a couple of researchers in our lab, the labor's their area.
We don't have a Department of Labor as far as I understand.
I just put that in there. We have a Department of Commerce, and under the Department of Commerce, there are labor-related divisions like Career Source and others. What we found in the ground here in Tallahassee is that We have made contact with some individuals within that department and within certain divisions that are assigned to have something to do with trafficking, labor trafficking in particular. So it takes a lot of work to find your person. That's what I'd encourage you to do at the local level. And it would be lovely to see that agency have the kind of focus on human trafficking that others do at the statewide level.
Well, I'll just close out because I know we're out of time. I'll just close out by saying, I think we've, our message to you is that this is for you. And if you're, I hope that you'll find some information in the state report that's useful for your work. And if you don't, please let us know, if we don't know what we don't know. So if you know there's data out there that we're not including, please, email us, or if there's ways that you would like us to look at the data that's not included in the state report. I promise you, we try to include all the data and be as transparent as possible. But if there are things that are missing, if questions you have that you please, email us and we'll try to work on that. This will be an annual report. So, please let us know how we can improve it to serve your needs.
Thank you.
Also, several people are asking for Kaylee's information and stuff on Bright. I've asked Ashley Pietre-Baker, who's listening, who works on Kaylee's team, to put into the chat who she is, her contact info, and Kaylee. So anybody who wants an application, get into Bright, access Bright, know more about services, you can reach out to Kaylee and Ashley, and she's going to put that in the chat for you.
As someone who's been working in this field in Florida for over 20 years, I can tell you that this is truly groundbreaking, incredible work. And I just cannot tell you how excited I am that you've done this as a comprehensive look and taking from all the different places, especially since it's not easy, even at the local level, to get this information. So that you've done it on a statewide level and deployed what you've done, just congratulations. I raise a glass to you for your excellent work. And I think that we have answered everybody's questions as we've gone. So, excuse me. Thank you to everyone, also to Jamie and Graciela on our team, and everybody on the USF team, TIPSTR, Bright, all of you. Let me also do another commercial and just tell you all that it's worth you looking at Bright and applying. It's very, very easy to do that. They will come and see you at some point at your agency. We had a great visit, and I thought that the process is so needed. That is another thing from the very start of our work in Florida 20 plus years ago, was how do you know who you can trust? How can you have a vetted agency? You all have done that. So it's huge. And you might not realize, y'all, how huge it is, but it is huge that you've done this. So thank you. And to all the people who passed the laws and have funded you to be able to do the work. Great work.
Real quick, Robin, Kaylee,
yeah.
Can you throw the link to the report in the chat again? Some people don't asking. So just get it in there one more time.
We also want you to know, and I will repeat it again, that we have this program and all of our other programs available for you to see on the website. We will be having this this webinar, the exact PowerPoint that you just saw, and the link to the report is up there now on the STAC website. Share it with your colleagues afterwards. We will send out something, and if you haven't joined STAC's website, newsletter, please do that, because we'll send out notes over time and just say, hey, last month's webinar is up if you missed it, and we'll tell you about next month's. And again, next month it's Brent Woody and Danielle Lennox to talk about expungement, which again, it's another big piece of our understanding that grows deeper every time we hear from them. So everybody, I think we need to have TIPSTR and Bright back for another webinar. We had y'all last year. We hope we'll have you again in 2026 because you're doing so much work. Yes, please. Also had people say, let's have a webinar on labor trafficking and what we can do more. We would love to do that. Maybe you can come on that. Joan, Dr. Reed, you're an expert on trauma. We need to have you also speak to us in depth on that issue, which we didn't even touch on here.
Thank you.
And we
Love
know
that.
that you've got those skills and understanding that really are unmatched. So here we go again, everyone. Thank you for coming. Thank you for being part of this. This movement and effort to go deeper and stronger and more knowledgeably and more compassionately to do this work around our state. And as we always say, it takes a village, and aren't we lucky to be in each other's village? So thank you to everybody who attended. Thank you to USF and also Just in Time Training. Lisa, we love you. Thank you for being just such a fine human being and doing this all the time with us. So everyone, enjoy your weekend, and we'll see you next month, August 15th, on expungement.
Thank
Bye,
you, Robin.
everyone.
Thank you for inviting us.
Always.
So much,
You're
Robin.
welcome.